cavities from coming back.
And the resin-modified GICs, they've managed to combine the best of both worlds. Great looks and strength without sacrificing that biocompatibility of traditional glass ionomers.
Exactly. And then there's calcium hydroxide cement. It's got a high pH, and it can actually encourage the tooth to form new dentin, making it a trusted tool for pulp therapy.
It's really inspiring to see how material science keeps pushing the limits, creating materials that not only do their job, but are also gentle on the mouth and help keep those teeth healthy in the long run.
I couldn't agree more. It's an exciting time to be in dentistry, seeing these innovations and putting them into practice to give our patients the best possible care. Yeah, it really is. Okay, so let's move on a bit. You've got a lot of notes on zinc phosphate cement too. What are your thoughts on it these days? I mean, there are so many new cement options out there now. Is it still relevant?
That's a great point. Zinc phosphate cement has been around forever. But with all the new stuff we've been talking about, it's worth asking, where does it fit in now? What about zinc phosphate cement is still important or interesting to you as you look at these materials?
Well, one thing that strikes me is that it's still relevant. Even with all the fancy new materials, lean phosphate cement still has its place, especially when you need something strong and reliable for permanent cementation.
It's like that old reliable tool you can always count on. But you've also pointed out that it's not perfect.
Right. It can be pretty acidic, which can be a problem, especially in those deeper restorations or when the pulp is already a bit sensitive. We got to be careful about that and take the right precautions, like using a liner or a base to protect the pulp.
And you've even got the ADA specification no barate for zinc phosphate cement broken down in your notes.
Wow.
That's the one that divides it into two types based on particle size, right?
Yeah.
What did you learn from looking at those classifications again?
Oh, it's a good reminder that even with something like zinc phosphate cement, which seems pretty basic, there are these subtle differences that affect how it works and what we use it for. Type I, with its finer grain, it's great for luting because we need a thin film and a really precise fit. But type 2, with the coarser grain, that one works for both luting and filling.
So even with zinc phosphate cement, it's about picking the right one for the job.
Exactly. And your nights go into how zinc phosphate cement is made too, breaking down the powder and the liquid parts and how important each ingredient is.
It is pretty cool how those basic ingredients, zinc oxide, magnesium oxide, phosphoric acid, all come together to make something so strong.
It really is. And like you pointed out in your notes, knowing how zinc phosphate cement sets is key to working with it effectively. How that powder and liquid interact, how much of each you use, the temperature, it all affects how long you have to work with it, how long it takes to set, and how it behaves in the end.
It's like following a recipe. You can change how things turn out by adjusting the ingredients and how you cook it.
I like that. And speaking of how things turn out, your notes also talk about the good and bad sides of zinc phosphate cement. It's strong under pressure and sticks well to the tooth, but it doesn't kill bacteria, and it can irritate the pulp.
Right. A good reminder that no material is perfect. Choosing the right one means weighing the pros and cons and thinking about what each patient needs in their specific situation.
Absolutely. And you also mentioned using cavity liners and bases with zinc phosphate cement, especially in deep restorations.
Yeah.
Protecting that pulp is super important.
It's all about keeping things balanced, making sure those restorative materials don't cause trouble for the living parts of the tooth. It's about minimizing irritation and making sure the tooth stays healthy and comfortable in the long run.
Exactly. And it's interesting how biocompatible materials have changed how we do restorative dentistry. They give us gentler options that help the tooth heal and avoid those bad reactions. You've got some good examples in your notes like glass ionomer cements, resin-modified GICs, and calcium hydroxide cement.
It's exciting to see how material science keeps getting better, giving us tools that work well and are kind to the tissues in the mouth, all for the sake of long-term oral health. And you've really been digging into the science behind these biocompatible materials, haven't you? Looking at what they're made of, how they behave, and how we use them in practice.
Yeah, I have. It's fascinating how their chemical makeup and structure affect how they interact with the tooth and the tissues around it. Glass ionomer cements, for example, they can bond chemically to the tooth and release fluoride over time. That's a pretty unique combo of benefits.
And those resin-modified GICs, they've taken glass ionomer technology even further. They've got better looks and strength, but they're still biocompatible.
Exactly. It's a real testament to how clever these researchers and manufacturers are. They're always trying to improve things, pushing the limits of what's possible in restorative dentistry.
And then there's calcium hydroxide cement. That's been a go-to for pulp therapy for ages. Your notes mention its high pH, how it can stimulate dentin formation, and its antimicrobial properties.
Calcium hydroxide cement is a classic for a reason. It's great for protecting the pulp, helping it heal, and creating the right conditions for new tissue to grow.
Okay, let's change gears a bit and talk about adhesion. You've got a whole section on the different types: mechanical, absorption, and diffusion. What have you learned from revisiting those basic concepts?
It's a good reminder that adhesion is like the foundation for good bonding. If we want to choose the right materials and use the right techniques, we need to understand how adhesion works, whether it's about things interlocking, chemical bonds forming, or molecules mixing together. The goal is always the same: create a strong, lasting connection between the restorative material and the tooth.
And you've been paying particular attention to composite resin. It's one of the most versatile materials we use, isn't it?
Composite resin has been a game changer for restorative dentistry. It's got the looks, the strength, and the versatility that we could only dream of before. It lets us create restorations that blend right in with the natural tooth structure so we can restore function and beauty at the same time.
And your notes really get into the details of composite resin,
Mhm.
what it's made of, how it behaves, and how to work with it. What are you finding most interesting or challenging about this material?
Well, one thing that always stands out to me is how you have to balance the organic and inorganic parts of composite resin. The polymer matrix is like the foundation, and then the filler particles give it strength and durability. It's amazing how the size, shape, and amount of those fillers can change the final properties of the material. That's how manufacturers can fine-tune it for different uses.
It's like having a whole toolbox full of different composite resins, each one perfect for a different job.
Exactly. You also pointed out the importance of the coupling agent, usually selene. That acts like a bridge between the organic matrix and those inorganic fillers, making sure they hold together really well.
It's mind-blowing when you think about all the chemistry involved in creating something that's both strong and beautiful.
It really is. And like you said in your notes, choosing the right material is only part of the story with composite resin. We also need to know how to handle it properly. Isolation, shade matching, layering techniques, light curing, it all matters.
Oh, light curing. That's such a crucial step. It's amazing how that specific light can trigger the polymerization reaction and turn that liquid into a solid restoration.
It's a process that needs both precision and an understanding of the science behind it. The intensity of the light, how long you use it, the distance, it all plays a role in getting that perfect cure, making sure the composite resin is as strong, durable, and good-looking as it can be.
Speaking of getting things right, you also mentioned how important bonding agents are for composite resin restorations. They're like the unsung heroes doing all the hard work behind the scenes.
They really are. Bonding agents are what connect the composite resin to the tooth structure, creating that strong, lasting bond that keeps bacteria and other stuff out and makes the restoration last longer.
And it's not just a simple matter of gluing things together, is it? You talked about the different steps involved, how the acidic monomers etch the tooth surface, and those hydrophilic monomers get into the dentin tubules, creating a hybrid layer where the bonding agent and the tooth kind of blend together.
It's really cool how the chemistry and mechanics all work together to create that seamless, strong bond. And those fancy bonding agents have really changed how we do composite resin restorations. We can be more conservative, preserve more of the natural tooth structure.
Adhesive dentistry has come a long way thanks to all the innovations in bonding technology. Okay, as we get to the last part of our deep dive, I'm curious about something you brought up: marginal integrity. Why is that so important for our restorations to last a long time?
Marginal integrity is crucial. It's all about how precisely the restorative material meets the tooth structure. We want a perfect seal, a tight fit that keeps bacteria, fluids, and debris from getting in.
It's like building a wall around the tooth, protecting it from all the stuff it has to deal with in the mouth.
Exactly. Even the tiniest gap at the margin can cause problems. It can lead to microleakage, recurrent decay, sensitivity, and eventually the restoration failing.
So it sounds like achieving and maintaining marginal integrity is a constant challenge that demands attention to detail at every step of the process.
You got it. It starts with getting the diagnosis right, planning the treatment carefully, and preparing the tooth precisely. We have to get rid of all the decay, create smooth, well-defined margins, and make sure there's enough space to place the restorative material properly.
And once the tooth is ready, the material we choose and how we place it must play a big role in getting that good marginal integrity.
Absolutely. The properties of the material, how easy it is to work with, and our skill in adapting it to the tooth, it all affects that final seal.
So here to think about shrinkage, flowability, even how much the material expands and contracts with temperature changes, right?
Exactly. And that's not all. How we finish and polish the restoration is super important too. We need to